This is a follow-along video for temporomandibular joint dysfunction that I did. Check out the link down below last week, and this is the gentle progression with the elastic band. If you have been doing the gentle stretching and exercises for your jaw, your head with myofascial release and your upper back and neck, then you are ready for this progression. So get your mat ready and the elastic band to join me. Okay friends, we'll start with the elastic band. It's nice to do some strength training first on your upper back to warm up your shoulders. In my last video, we did a gentle range of motion backwards to stretch because there's a correlation of forward head and rounded shoulders that causes less support on your temporomandibular joint. And if you want to learn more about it, please check out the link down below or in my info card up there, where you can find out the link to learn more about temporomandibular joint. Because if you know how to target this problem, then you can see progression. And if you have knowledge about the muscles surrounding your jaw muscles, then you know how to target this condition. So what I'm doing right now is I'm doing a warm-up first. Warming your shoulders backward because your shoulders are the foundation for your neck and your head area. So you take a deep breath, engage your core muscles. Inhale, belly button in and blow. We'll do this 10 times. And 5, 4, 3, 2, 1. And now we're gonna slowly open our chest more. Hands on your fingers, clasp a little bit and slowly open and gently look up. Take a deep breath and blow. Right now I'm sitting up cross-legged, and you can be sitting in your chair or lying down. If it's too much jaw pain, you can do this lying down, as long as you can open your fingers out to the edge of your bed where you're having trouble. If it's your right side, then your right side should be at the edge of the bed. Take a deep breath, belly button in and blow. We'll do this 10 times as well. This is a follow-along video that you can join me with your breaths. Inhale and blow. 5 more. 4. Take a deep breath, belly button in. I'm pulling my stomach in to engage my core. 3 more and blow. 1 breath, 1 motion. 2. Last one and 1. I know we're not touching our jaw yet because we're slowly warming up our shoulder area, and then we're going to utilize the elastic band with your hands behind your head, elbows out. We're warming up, opening up our chest and looking up for a forward head around the shoulder posture. This will help support your jaw area or your temporomandibular joint. Take a deep breath and blow. And we'll do this 10 times as well. Belly button in and blow. I'm still pulling my stomach in. Take a deep breath and blow. Inhale and blow. Belly button in and blow. 5 more to go. Take a deep breath and blow. The more you inhale through your nose to filter the air and relax your jaw muscles and blow. The more you take more air in, the more you expand your diaphragm and have more air into your lungs. And oxygen helps healing for inflammation, so taking deep breaths helps also relax the muscles and inflammation. Last one, take a deep breath and hold it for 5, 4, 3, 2, 1. And I'm still pushing my elbows out and then slowly lean. Take a deep breath, belly button in and blow. And then if your problem is more on your right side, then you do an extra more lean on the area where you have the tightness, away from the tightness. And you feel the pulling pain all the way to your neck. Take a deep breath and blow. And now we're going to the right side. Take a deep breath, belly button in, feel that lovely stretch. I'm still keeping my head straight. and then leaning to the side, keeping my elbow open as much as you can. We'll do this 10 times as well, and blow both ways 10 times. Take a deep breath and blow. Belly button in. I'm still engaging my core with my breaths, and blow. One breath, one motion. Take a deep breath. You can do this every day, or at least twice a day if you can, or even your break time at work if you have time during your lunch break. So you can do this 3 times a day to help open your jaw from having this tightness and pain, clicking and popping, and difficulty eating and munching our food. So it's best to do this every single day. Take a deep breath, belly button in, and blow. If your inflammation is a lot, please see your doctor, as well as get some anti-inflammatory drugs if you need it with your doctor's prescription to help decrease the inflammation. Drink a lot of water. Try to drink cold water to help the swelling, as well as not to eat hard food, mostly soup base or liquid base for now, to help the inflammation. Take a deep breath, last one, and hold it for 5, 4, 3, 2, 1, and then last one on the right side. Take a deep breath, and 5, 4, 3, 2, 1, and the progression, you're going to turn your body with the trunk twist. You're really targeting your sternocleidomastoid muscle that helps our head rotation, and it's also discussed, as I said in my previous video, regarding this muscle, and it's important to stretch this. So with this trunk twisting, this is the next progression that I didn't do in my last video. Take a deep breath, belly button in, still twist, and we're gonna do this 10 times each way. Take a deep breath. If sitting cross-legged is difficult and you want to still sit on the mat, then get a pillow to sit on to lengthen your spine. Take a deep breath, belly button in, and blow. So having your hands up like this is a little bit more progression and tiring on your shoulders. If this is too difficult, you can put your hands down and just turn your head. Take a deep breath, belly button in, and blow. Even though my hands are behind my head, I'm still keeping my body straight without leaning forward. You want to keep it open and still position with your shoulders. Take a deep breath, last one, and hold it for 5, 4, 3, 2, 1, and back. Take a deep breath, 5, 4, 3, 2, 1, and blow. After that lovely warm up and stretching, we use the band. This is a blue band. You can use a less resistance, and from this position, we're going to do horizontal shoulder abduction to target your muscles behind you on your upper back. Take a deep breath, belly button in, and blow. We'll do this 10 times. Feel that all the way out, and then slowly look up for progression. Take a deep breath and blow. Inhale, belly button in, and blow. Take a deep breath, belly button in, and blow. 5 more to go. Inhale through your nose. Feel that lovely pull on your upper back. Inhale. This will help support your neck and all the way to your TMJ, which is your joint that needs a lot of support. Take a deep breath, 3 more. Belly button in and blow. 2 more, inhale. Belly button in, hold it, and blow. Last one, take a deep breath and hold it for 5, 4, 3, 2, 1. And I'm looking up to really stretch your neck up more. Okay, now wrap this behind you. So if your problem is in your right side, I'm going to put my hand up here on my right, and I'm going to pull this up diagonally behind me. Take a deep breath and hold it for 5, 4, 3, 2, 1. So the band is behind me, so I'm just pulling up. So when you pull up, it helps lift the lopsided jaw area. Usually with TMJ, one side is lower when you're sitting up straight, and you'll be surprised when you look in the mirror, one side is lower. You really have to have an eye to see it, but usually most TMJ, the weaker side is lower, and you need to lift it up. So with your shoulders help, it helps lift that one side weakness. So I'm pretending it's my right side, so choose which side you're having. So And then that's where you lift with your arm. So if it's your left TMJ, then you're lifting your left arm up. And we'll do this 10 times. With 5 seconds hold, take a deep breath. Still engaging your core. And 5, 4, 3, 2, 1. And we'll do this 10 times. We're halfway to go. Take a deep breath. Belly button in and blow. 4 more. Take a deep breath. Belly button in. And you'll be surprised, even your shoulders are also weak on the side where you have the TMD or temporomandibular dysfunction. It's not functioning well because it's a weaker side. It causes more locking and clicking, and you want to make sure you can open your mouth. And if it's not aligned properly, it gets stuck like a hinge of a door, stuck on the doorway, and you can't open the door. And it's really frustrating for most of us because we need to open our mouth to eat and to survive. And it's really frustrating. And I've been there too. So I remembered having TMD as well. And it took me a month to recover, a lot of dedication and self-therapy after dental work that didn't do well. And sometimes you really need to see a dentist to have it fixed on your molar area. And last hold for 5, 4, 3, 2, 1, and blow. Okay, let's move the band for now, and let's start targeting our jaw area now. After that lovely warm up, now this is really warm and ready with the blood flowing, and you can put some hot compress before you start as well if it's really tender to touch, because we're gonna open our mouth now. With our thumb, we're gonna start a little bit pressure here. Take a deep breath. I'm not gonna open my mouth yet. I'm gonna slowly release more tension away from the jaw by doing a little bit myofascial pressure underneath the condyles of your joint on your TMJ, and slowly look up and down. And because you might have headaches on your temporal area, it's nice to put pressure with your fingers and your jaw and slowly look up. Take a deep breath and hold it for 5, 4, 3, 2, 1, and blow. And we'll do this 10 times. Take a deep breath. I'm slowly putting more pressure on my temporal bone area and my condyle of my TMJ. And take a deep breath and lift with your breath and blow. Inhale through your nose, belly button in. And I'm really looking up to really stretch your neck area and blow. Halfway to go, take a deep breath. Belly button in and blow. Take a deep breath. So I showed this in my last video that you can check down the link below. And I'm gonna do a few more progressions before we start opening our mouth. Because this is, if you've been doing the exercises for at least a week, then you're ready for this progression. Last one, take a deep breath. Belly button in. And 5, 4, 3, 2, 1, and blow. And after doing that, now you're gonna feel if this is the right side that we have problem. I'm gonna do more release on this side with my thumb there, fingers on my temporal. Take a deep breath, and then I'm gonna push away with the tightness here. I'm still not opening my mouth. So this is the gentle progression from last time, the video for beginners that I did. And we'll do this 10 times as well, because this is a follow along. I have to follow through with 10 repetitions and blow. Take a deep breath. So I'm pretending it's only my right side. So if it's your left, then do the opposite side. And if it's the right, then follow me like your mirror. Take a deep breath. So with my right side, I'm going to the left. Belly button in, still engaging my core muscles, and blow. Inhale through your nose and blow. Belly button in. Feel that love. So now the more we do this myofascial release, we are really progressing more and really lengthening the area where it's so tight and cramping a lot on your jaw area all the way to your neck and scalp area. Last one, take a deep breath, belly button in and blow. Now we're gonna start with some isometrics before we open our mouth. So when you do isometrics, you're contracting without moving your jaw and still having tension. And then After that, we'll do some more stretching, so that will help to open your jaw more, like a contract, relax. So with my fingers and thumbs on the area where it's tight, I'm gonna do a gentle push on the jaw, and then I'm gonna slowly open and hold it there for 5 seconds. Gently pushing without really moving, and blow with your breath. Take a deep breath through your nose and push gently. Don't do it too hard, that causes more jamming on your jaw. And just do it 5 times, because I don't want to be too aggressive, because it's still inflamed. Now if it's my right side, I'm going to do some isometrics with my fist on your masseter area. Slightly open your mouth, and I'm gently pushing with my fist on my face for 5 seconds. Hold with your breaths to relax more. And we'll do it 5 times. Take a deep breath. 2 more. Take a deep breath. I'm not really swaying my jaw side to side. You don't want that glide. We're gonna do isometrics. And then we're also gonna target even the good side, because when you push here, you're also strengthening the inner part of your pterygoid. We call it the middle pterygoid. That helps medial glide this way. And you feel a little bit pressure. And my suggestion is 5 seconds hold. 5 times for now. To slowly progress to 10 repetitions when you're ready. And after doing 5 times in each way, then you can do bilateral, which is at the same time. Even though you're not moving, there's tension going in. 5 seconds hold, up to 5 times. And I'm really opening my mouth now, so I could put my fist in my cheek area. Cheeks, both cheeks. 2 more, take a deep breath. 5 seconds hold, last one. Okay, now I'm gonna put my pressure on my chin area. We're gonna do forward protrusion, because the lateral pterygoid helps the protrusion. And you can look back at my previous video to learn more about these muscles. 5 seconds hold. I'm not really going protrusion too much, just gentle, a little bit push forward, but not too much to the point of blocking your jaw. Isometrics means no movement, so I'm just opening gently, and then I'm going to press and hold. Last one, take a deep breath and blow for 5. Okay, after that isometrics, now a progression for more myofascial release, now this time with opening and neck movement. So with my thumb again on my condyle, fingers on my temporal, I'm going to slowly open my mouth now, together with my push and looking up slowly. And when I reach to the end range, then I'm really going to open my mouth and hold it for 5 seconds. Take a deep breath through your nose, belly button in, and lift. Three more to go. Take a deep breath, thumbs on your condyle and your temporal bone. And you feel a little bit easier to open your mouth now. Take a deep breath. Last one, take a deep breath through your nose. And blow. You feel a little bit less headache and more movement. So we'll just do 5 repetitions right now, and then we're going to progress when you're ready, when you feel like you can open your mouth more. Now the progression in this one is with the elastic band. You're going to place this behind your head near the jaw area of your temporal. So if this is the problem side, so I'm really going to place the band near the jaw. So this is the progression, and then you're going to slowly look up and open your mouth and hold 5 seconds, hold at the end, and you're going to really extend your elbow to feel the pressure on your jaw. Take a deep breath and open slowly and blow. We'll do it 5 times today. Follow along. Two more to go. Take a deep breath, belly button in. Last one, take a deep breath through your nose while open your mouth. And the progression, and as I discussed before, the suprahyoid, which is your tongue muscle, helps support your TMJ to help the opening of your mouth. So placing your tongue at the roof of your palate and really pressing it up helps strengthen your tongue muscles, as well as helps lift the TMJ area. So let's do that again with your thumb on your jaw, fingers on your temporal, and this time, this is the 3rd progression. I'm placing my tongue again at the roof of my palate. It's gonna be hard with pain, but the more you do it, the better it gets. We'll do it 5 times right now, and we're gonna progress 10 next time when you're ready. And I held it for 5 seconds, hold at the top. 4 more to go. Take a deep breath through your nose. So sometimes it's really hard to really push it up because of weakness of your tongue. It's okay, it gets better when the more you do it. So I'm placing again at the roof of my palate with my tongue, and hold it for 5 seconds. When I reach up, if looking up is difficult, then you can just hold it here in this position, straight plane. But as I said, this is the progression that we can do to challenge ourselves to fully recover on this TMJ so it won't come back again. If you do this every single day, then you will see result, as well as maintenance. It's like taking your own medication. Exercises are so healthy that helps our aches and pains to combat joint pain. Okay, we did 5 times, and the progression again is with the elastic band. Again, on your neck area, at the base of your skull, and you're gonna place the band near the jaw, the joint area of your jaw or your TMJ, and then slowly look up with your tongue at the roof of your palate. And 5 seconds hold. Take a deep breath. And you'll notice your tongue might be shifting left or right. Usually it shifts to the stronger side because it's the stronger side. So if it's the weaker side is your left, then it will shift to the right. But if your TMJ dysfunction is on your right jaw, then it will shift to the left. And you want to keep it balanced with your tip of your tongue centered. You can do this in front of a mirror so you can see your tongue movement as well as the mouth opening. So you'll see one side has a little bit more opening, which is your good side. So you want to really be mindful on how you open your mouth. 2 more to go. Take a deep breath, slowly lifting, elbow straight and looking up. Tip of your tongue or the whole tongue at the roof of your palate, and then gently open. And then hold it for 5 seconds. Hold. This is the last one. Take a deep breath. Elbow straight, look up. level with your jaw, with your band. Tip the tongue at the roof of the palate and slowly open your mouth. And holding that for 5 seconds. So, okay, now we're gonna do myofascial release of your scalenes at the base of your skull. Here, this will help your forward head posture at the same time with your headache, and the rest of my fingers on my scalp to massage and slowly open again and hold it for 5, 4, 3, 2, 1. This will help release all the tension of your head and your neck. Take a deep breath, hold it for 5, 4, 3, 2, 1. We are cooling down now. 3 more. Take a deep breath and 5, 4, 3, 2, 1. And this will help relax more. Our scalp is also muscle that helps support our facial muscles. And now I'm going to do different facial expressions to strengthen my facial muscles, because when you're not eating and not talking with pain, it gets weak. So I'm going to do some smiling faces while doing this. Sad face. Mad. Shock. Afraid. Excited. And then continue with your singing if you love to sing. And now I'm gonna stretch my neck muscles more. I'm gonna focus on my right, pretending it's my right side. And then hands out, fingers out, and lean. And then look on your armpit to stretch your levator scapulae. And then we're cooling down now. Let's do it on the other side as well, to keep everything balanced. And looking on my armpit and looking straight for my scalenes. Again, one more time to the scalene sideways. Fingers out. Hold it for 5, 4, 3, 2, 1. Look at your armpit. 5, 4, 3, 2, 1. Back to the center. Side. 5, 4, 3, 2, 1. On my armpit. 5, 4, 3, 2, 1. And now open up more. Fingers and up and close. Cooling down. 3 more. Take a deep breath. You guys did amazing. Hope you feel much better on your jaw area and improve your posture and have a forward head. Follow along rounded shoulder posture. You can check out down the link below as well if you like. And if it's coming on your cervical area for nerve impingement, you can also check out the link about cervical disc herniation that could cause pain on your shoulders. And if you have thoracic outlet syndrome that I just did recently, you can also check that out to help your posture and your shoulders. If you have shoulder impingement, I have more videos down the link below. Or scapular winging, which is winging up your scapula. These are all upper back or upper cross syndrome that you can fix first to help your posture, and then it will help your TMJ if you have them. But if you don't have them, you can also do them to keep your upper back strong and healthy to add in your program. Thanks again for watching. I'm hoping you're feeling much better on your jaw area. You can put some ice after this exercise. Heat before for 20 minutes and ice after for another 20 minutes on your jaw to help decrease the inflammation and pain. Please like and subscribe my channel. Ring the notification bell for future updates just like this one. I upload videos every Wednesdays, Fridays, Sundays, and sometimes Mondays for Pilates, yoga, physical therapy, health, and wellness. You can also follow me on my social media, my Facebook, Instagram, Reddit, and I also have a Patreon account that you can check out the link down below to support my channel financially, and have more social media that you can check out. You can leave comments, suggestions, or special requests for anything that you might need. Thanks again for watching. Have a great and stronger jaw and healthier you. Bye!